Welcome back, everyone. This now brings us to our final session of the day, where we have the pleasure of welcoming a panel of individuals and caregivers with gene therapy treatment experience. To kick off our discussion at Level Set, we wanted to poll the audience with one final question. Which of the following responses best describes where you or a loved one are at related to receiving a cell and gene therapy treatment? As a reminder, to access the poll, you can locate the Q&A and polls tab to the right of the video player. If you participated in the poll earlier, you'll have to hit next. If you did not participate in that poll earlier, you may see a question from earlier today, which you will need to respond to in order to see the next question. And then we'll take a look at these answers shortly. Now I'm joined by Lee Greenwood, whose daughter received a gene therapy for Canavan disease, Jimi Olaghere, who is treated with Casgevy for sickle cell disease, and Francita Tador, who is a caregiver to her son, who received leukemia for SCD and is herself a sickle cell warrior. Lee, Jim, and Francita will bring insight to the experiences and considerations for pursuing a gene therapy treatment. Before our speakers share more about their stories, if the poll results are ready, I would like to share those, and if not, we can share them after a bit. And it looks like 33% no treatment options yet, but hoping there will be, and 59% not applicable right now. So that will help frame our conversation later. For now, I would like to pass it over to Lee Greenwood.
Thanks, Matt. I appreciate that. Good afternoon, everybody. My name is Lee. I am the dad to two amazing kiddos, Max, my older kid, who's typically developing, and then Noah, the kid you see there in all of her wonder with her snakes and her favorite things, playgrounds and bikes. Noah is 5.5 years old. She's currently upstairs right now in bed having a sick day. She's taken to telling us that she has a sick day more and more now that she's getting older and wants to watch TV all day, but that's where we're at. Noah was born in August of 2020, right in the middle of the pandemic. She came out as a healthy kiddo. She was at, I believe, around the 90th weight percentile. So she came out, she looked good. Everything seemed great at first. We brought her home, and within a few weeks, things kind of took a little bit of a turn for Noah. The first thing that we noticed with her was she just cried all the time. She cried and cried and cried. She was crying constantly. The only time she would not be crying was when she was either eating, being held in the shower, or sleeping. Then the next thing that we noticed, we had a kid already. We didn't think too much of it, but it seemed, a little bit off. But again, it was during the pandemic, so our options were limited as far as how to proceed. The next thing we noticed was her vision. Typically, developing kids, will look and make eye contact at some point. Noah kind of looked through us, and that kind of put us a little bit more on our radar of what's going on here. So at about 6 months, Noah, at her checkup with her pediatrician, she had dropped from about the 89th or 90th percentile in weight down to the 23rd or 24th percentile. And that was really the first real big red flag for her medical providers, for her pediatrician, and for us that, something is going on with this. And that got us into the EI journey. Again, we were doing PT and OT back then, all on Zoom. That was quite an experience. But eventually we got in to speak to a pediatric neurologist at Boston Children's Hospital. And, at first on Zoom, the neurologist thought that something was off, but she thought it might have been just some sort of benign macrocephaly, some sort of big head thing that might ease over time. But she wanted to see Noah to confirm. And so we brought her in about a month later, and when she came in, we could tell, my wife Lori and I could tell that on her face, like she looked at Noah and she could immediately tell, this is something else, something is off that she didn't pick up on Zoom. she didn't know what it was, but she wanted an MRI to figure things out, and so we went about scheduling that. And then on August 9th, 2021, 10 days, excuse me, 11 days before Noah's first birthday, she had her MRI. And then the next day, on Zoom of all things, we got the news that no parent, that so many folks on this call have gotten, that my daughter has a incredibly serious, fatal, degenerative neurological disease called Canavan disease. And no one in my family has a scientific, well, my wife and I, neither of us have a scientific background. So of course we're doing what everybody does when you get something like that. We started Googling, and the first thing, like I said, that pops up when you see Canavan disease is the lifespan, and the life expectancy is listed online at 10 years of age. That is a pretty awful thing, as so many of us on this call know. That's a pretty awful thing to be getting the news of. But in the same call with our neurologist, at the same time that she was giving us this terrible news, she also said, but just today, a clinical trial, a gene therapy clinical trial, happened to have posted on clinicaltrials.gov just the same day that Noah was diagnosed. And it also happened to just be being run out of Boston, where we live, at Mass General Hospital. And our neurologist said, and I've made an appointment for you with the doctors over there already. So, we were the first families to get Canavan disease. Like I said, it's a degenerative neurological disease, and there's no approved therapies. And this was the first trial. And so we were the first family to get this devastating news, and at the same breath, get the but part of that story. But there is something to pursue. But there is some hope. Sorry. So Lori and I obviously were in shock. We were grieving everything, but we immediately had to figure out if we wanted to pursue the trial with Noah. And I don't know, we're going to get to this a little bit later, but that for us, we both knew right away, after figuring out, wrapping our heads a little bit around what Canavan disease is, what it looks like, and how it affects patients and families. We both knew that we wanted to pursue this trial. And then we were in let's do it mode, which took a while. It was, again, a brand new trial, no data, no patients had been dosed at that point. And so there had already been, we subsequently learned, there were already 2 kiddos who were lined up to be dosed ahead of Noah. And so then flash forward to June 15th of 2022, about 22 months of age. Noah was the 3rd kid dosed as part of this gene therapy trial. And it was, we call it her dose-iversary, because it was this amazing experience in her life where she got this very just generic looking IV in her arm, nothing special. I was expecting some sort of fanfare when this amazing product rolled into her room at the hospital, but it was just a nurse with a needle and an IV. At first, because there was nothing that we could look at in this space yet to know what to expect, Lori and I both had no expectations whatsoever. I know Lori says that her hopes were that Noah wouldn't regress any further. Again, it's a degenerative disease, and so she was hoping that there would be no more regression. And Noah was already starting at dosing, at her dosing date, was already showing signs of regressing. She was a pretty high functioning Canavan kiddo. She could prop herself up and sit kind of as a tripod. She was able to army crawl a little bit around our house, but she was starting to lose those skills. And so Lori hoped that there would be no more regression. I did not give myself the emotional space to have any sort of expectations or hope. I knew it would just be too much. But after she was dosed, pretty quickly, a few months after, it became pretty clear that things were mean, for lack of a better word, they were working. Noah started to be able to sit independently. She started to be able to reach, to sit with two hands at first, then sit with one hand, and then sit with no hands, and then crawl, and then eventually stand up and with holding against the wall. And flash forward now to where we are, almost 4 years post dosing, and Noah is a kindergartner in Boston Public Schools. She, as you can see in the video there, she's a little naughty, amazing, wonderful little child who loves to splash in puddles and ride her bike and go down swings. I love that picture of her hanging from the at the playground. It just, I feel like it captures so much her spirit, her willingness to just go and do whatever it is that she wants, like any 5-year-old should. And then my face of both amazement, and wonder, and also just pure fear of, oh my God, my Canavan kid is hanging on the playground. And yet that's where we're at. Every day is kind of a mix of all those emotions of, oh my God, look at what she's doing. She's walking, she's running, she's talking, she's counting, she's learning her letters, mixed with all of the other emotions. And it's a pretty amazing, remarkable, whatever adjective you want to use. It's been a real wild ride for us, and we're just thrilled to be on it. And Noah continues to develop a pace. She's still rocking it. Every day is a new exciting journey with us. And we don't know what happens tomorrow or next month or next year, but we know right now, and right now is pretty awesome. Yeah.
Thank you so much, Lee, for sharing. We really appreciate that. Next, Francita, would you like to share your story?
Hi, yes, my name is Francita. I am a caregiver to a child named Caden Major who has sickle cell disease. I am also a warrior as well. I have sickle cell disease SS. I have 2 kids. Caden is 19 and my daughter is 7 years old. So Caden was born obviously with sickle cell disease. And since when I was pregnant with him, I kind of figured that they told me that it's a great possibility that this child would be born with sickle cell disease. So 6 months after being born, Caden experienced his first pain crisis. And since then, he's had pain every single year from 6 months all the way to 18 years old. So every year of Caden's school year, he missed at least a semester or a quarter. It started off missing a quarter of school, and then it increased to missing a semester of school every single year. He had debilitating pain once he became high school grade, like 9th grade. And at that time, the pain got so bad with Caden. The pain never left. The pain was extremely excruciating for him. And so the pain at that time was from an 8 to 10 out of 10 every single day. We had some days that was probably a 7 out of 10, but most of the time it was an 8 to 10 out of 10 every single day. And we knew things were getting bad. At that time, morphine, Dilaudid, was starting to not work for him. And he was needing more and more drugs to kind of keep functioning every day. It was monthly transfusions just to see how he would, do with that. Would that be, help him to not get so much crisis, So after that, we thought our year was going to be high school. We thought that was going to be a great year, that he was going to go into high school and have no pain crisis. But that actually was opposite. It actually got chronic then. That's when his pain became extremely, extremely bad. And we just didn't know what to do at that point. We were doing everything that we knew to do. We were giving him the blood transfusions. He was going to the clinics for IV pain infusion 2 to 3 times a week just to sustain life. So Caden was starting to have a life where he was watching people around him live life. He was not actually participating in life. He was just watching other people live their life. throughout his, entire years, So as a parent, your heart is breaking. And although I have sickle cell, it didn't look like that. It didn't present the same way in me. We have the same genotype. However, his type seems like a more severe type. It's the same, but it presented more severe in Caden. So he just, we was at our wits end, and so we learned about gene therapy. We didn't know much about it. We were told about it towards his high school years. They told us there was something coming down the pipeline, and there was something called gene therapy that will probably be available. So we talked about it. Caden was a little bit reluctant to have it done. He didn't kind of understand the whole dynamics of it. He knew that he had to get his hair cut. They talked about fertility preservation, and he was just like, "Oh no, I don't kind of want it. I'm a little scared." But as a mother, I knew that is something that we had to kind of take hold and kind of grab onto, because we had no other options. Things were getting really, really, really bad. Our life was becoming just hospital, hospital, hospital. We couldn't plan anything. Our days was just, we didn't know what our days kind of look like because of this disease. You wake up, you don't know what your day will be. Any plans you may have can go out the window, because at night you wake up, it's 2 o'clock, pain medication. It's 6 o'clock, pain medication. Like, you just don't know as a parent. So when we got, the chance to, they were talking about gene therapy, I was intrigued a little bit. So I kind of did my own research, and I looked into it to see, if it was an option for him, because it's difficult as a parent to make a decision like this for a child, because if it goes wrong, it's like you have to live with this decision that you've made. So I extensively talked with Caden. However, we had an admission that was 2 months, and that to me was what sealed the deal for Caden. I wanted Caden to kind of be on board with gene therapy, not just me as his caregiver. I wanted him to also, because he was 18, I wanted him to be like, yes, I want this gene therapy, because I believe your mental matters when you go into something like this, especially at that age. You have to be mentally kind of ready to know that you're going to fight and you're going to push through whatever this thing throws at you. You've been fighting all your life. Why not fight, throughout this treatment as well? So once he got this 2 months admission, that kind of sealed the deal for Caden. Caden was like, I'm sick of doctors. No more doctors for me. I don't want to see them anymore. No more nurses. I don't want to go to the hospital. I am done. I'm fed up. I'm tired of this pain. The pain is getting worse. It doesn't matter what they give me. I am still in pain. I'm living life in pain. My friend's about to graduate, and I'm not. Because of this, Caden was unable to kind of do in-person learning. So once he was in 9th grade, he did well the first semester. Second semester, pain started. That's when the chronic pain had started. And so we had to take him out of school, in-person learning. And so we did virtual. Virtual didn't work. Then we did homeschool. Homeschool was hard. Just so moving forward, he was behind 2 to 3 years of school at that time, because the pain was just that bad. So he's watching now his friends graduating. He's watching them start their life in college. So Caden he was fed up. That was what sealed the deal. That 2 months, he was like, I'm done with this. So we went ahead and went through with the gene therapy, and we didn't know what to expect. They told us, it may take 6 months to a year to actually see results with the gene therapy. He got done, Lyfgenia. And throughout this, I was talking to the patient care support at for Lyfgenia. They helped me. They actually told me about, the different steps, what to think about, what may happen, and kind of I was preparing him mentally to kind of go through this, to kind of talk to him and saying, you got this, kind of peppering him, and you can do it. I'm going to be there with you every step of the way. So for me as a caregiver, my challenge was, how do I keep my family together, be there for Caden, and also be there for my 7-year-old and my husband? How do I manage that because he has to be in for 6 weeks. So I'm like, at that time, to me, that was a challenge, but we worked it out. Caden got the gene therapy, and 2 weeks after the transplant, he experienced no pain no more. Like, since it took 18 years, he was like, "Wait, I don't know, is this real? Do I have no pain?" And so we were like, wow, even like, because before, even the shower used to trigger Caden. So we actually was like, get in the shower. I want you to stay even extra long in the shower this time. I want to see if this thing is true. Stay in there. And so he came out and he was like, I have no pain. I really have no pain. And I was like, okay, let's check again tomorrow. Let's hold up. Let's not get too excited. We were just still skeptical because he had pain all his life. He didn't know how life kind of looked like without sickle cell disease, without having chronic pain. He had it so long that it became part of him. And so next day, next week, next month. So Caden, we are now 10 months out. Caden is still pain free. Caden is starting his life. He's going back to school. He's getting his GED. He's about to eventually take the GED test and start college. His life looks totally different. And it's an adjustment as a caregiver because your life was taking care of this child, was taking care of him and kind of helping him mentally, physically, kind of getting him to kind of see that who he is, the potential what he has, to be in life. And I'm like, now, like, the doors are just open for him. Before, you had limitations. You can't do this, you can't do that. Now with you can do anything you want. And I think now that takes an adjustment, being, prepared for life and mentally prepared. Like, I no longer have sickle cell. So I'm just thankful for the support groups that we had, for the patient care support group from Virginia, and also from the insurance. Like, they really helped us along. They had their own gene therapy support group. And we have our local ASAP group that actually helps us along the way. And my family. I mean, I couldn't do this without our family. Our support system kind of actually what held us down. And Caden is now living life as a regular young adult without sickle cell disease. And that every day is a blessing.
Thank you so much, Francita. It's such a wonderful story.
Thank you.
And now we'll pass it over to Jimmy.
Hey everyone, my name is Jimi Olaghere. I was diagnosed with sickle cell disease at birth. I was born in Washington, D.C., but I'm actually Nigerian. In 1985, back then, when I was conceived, my mom did not have access to newborn screening. So she flew to the US. Probably one of the reasons I'm alive today is that trip to the US. She flew to the US to deliver me to one, get that newborn, actually, it's not even newborn screening, it's prenatal screening, amniocentesis test, I believe it's what it's called. And standard of care back then, if you're Nigerian with severe sickle cell disease, which is what I would potentially have, or was the doctor had told my parents I would have, is one, you confirm that you have this disease, and then two, it's to have an abortion. So my mom was coming to the US to get the best confirmation and the best abortion. And unfortunately for her, and fortunately for me, I should say, the test came back quite late. I think back then, the amniocentesis test usually would take about 2 months. And this particular time, it took 7 months, which obviously quite late to have an abortion. So she decided, and also being how big of a faith-based woman she is, she decided to deliver me. And she prayed one day I would be cured, which in hindsight kind of worked. So I was born here in Washington, in the U.S., and I ended up moving back to Nigeria to grow as a toddler there. I grew up with the disease, and I remember having extreme bouts of pain for 12 to 24 hours. And the only thing we had was a menthol rub and a paracetamol, which is over the counter Tylenol here. And that was it for pain management or just managing the disease. Eventually, my parents thought it'd probably be a good idea to move back to the US to get better access to more care, expanded access to care. and living in the US, we were of the belief that it would improve my quality of life, which it did initially I moved back. I think I moved back as a young teenager. And as when I came to realize as I continued to grow old, almost similar to Cadence, the disease actually got worse, regardless of the access to care I now have living in the US. My pain crises were a lot more painful. I was having organ damage. My gallbladder had to be taken out. I was 7 hours from losing my spleen. It felt like walking on the edge of a cliff perpetually. That's what it feels like living with sickle cell disease, because you absolutely don't know what's going to happen next, but you know something's coming. Because essentially it's a disease of the entire organs, your lungs, your brain, even your eyes. I've gone blind once from sickle cell disease. So it was extremely terrifying. It felt like a succession of time bombs, and excuse the pun. But that's what it felt like living with sickle cell disease. And at some point, I'd become quite jaded and hopeless, having similar experiences to Francita's son, just watching life pass me by and not being able to do anything. I still don't have a college degree till this day. Never gone back to college though. I'm a horrible student, so I'm not going to blame sickle cell for that. But it definitely did play a role in why I never finished, because I was always sick. I remember every semester I had to withdraw and would come back next semester to attempt it again, and it would be the same outcome. So at one point I just ended up giving up that dream. Another fantastic dream I've always wanted to have is I've always wanted to be a father, and also sickle cell kind of played a role in delaying that. I'm sure you can tell by the pictures that I was eventually able to become a father, and that's actually what led me to my gene therapy. After probably 20, 25 years of living with the disease, not being able to achieve my ambitions, that actually become depressed, suicidal, and like I said, not really wanting to really living life cavalierly, I should say. And my parents actually noticed that, and they started to push me to actually find a solution to this disease. And I really wasn't interested. It wasn't until I actually suffered a cardiac arrest after a simple portal cart insertion. Usually, when you have sickle cell disease, any surgery you have, it's standard of care to have a transfusion. And for this particular outpatient surgery, the surgeon was not interested in doing that. Um, I guess he really didn't know too much about sickle cell, but he was really adamant at, hey, this is an outpatient procedure. We're not doing any blood transfusion. You're just going to place this simple portacath, and you can go home and you'll be fine. And that's not what happened. After the portacath was placed, on the drive home, I actually suffered a cardiac arrest, and they had to send me back to the hospital. It wasn't until I had that I was just like, okay, maybe it is time to actually find a solution. But at the same time, still quite not really interested. So we went through a couple of steps. I tried the bone marrow route. I didn't have a match in any of my sisters. And then I started doing research on gene therapy, and I ended up using a Google alert on the keywords gene editing and sickle cell disease. And I really done this to appease my parents, really not for me, if I'm honest. And to my surprise, after doing that research, I got an article in my inbox. It was an NPR article about a woman called Victoria Gray, who was the first person to receive a CRISPR-based gene therapy for sickle cell disease. At the same time, I've actually also, as when I had done that research, I'd actually gotten successful. My wife, ex-wife at the time, had gotten we've been able to achieve that goal of becoming parents. She was 8 months pregnant. So at this time in my life, I had actually had a change in mindsets of, hey, and I desperately want to be here now. And so the two kind of coincided. It was quite serendipitous that I had found this gene therapy while I was about to become a father. So I was actually now really desperate to make sure that I am here on Earth while I have a son. So at the end of that article that I read, they had the PI, and I reached out to him the next day. He reached back out, trying to see if I qualify for this clinical trial. And thankfully, I did, which was fantastic. I was extremely desperate at this point. I didn't really even read the consent form. I ended up reading it, but I had to actually be forced, sat down, and we had they had to, they took me to the page that showed all the potential side effects, and everyone was like terrified. What if you get an off-target edit? What if you get like a cancer? What if, and for me, it didn't move me at all. I wasn't terrified or afraid in any because I was just so desperate to get this therapy. So I just wanted to sign on the dotted line, which I obviously eventually ended up doing. And that was also during the pandemic in 2020. I started off as patient number 16, but because I lived in the Southeast where the treatment center was located in Nashville when the pandemic happened, I ended up being elevated to patient number 4 because I could drive to Nashville as opposed to flying. So that actually helped me out as well. I received the therapy. I got infused, I should say, in September of 2020, similar to Lee, very, very anticlimactic. We had done these crazy collection rounds that was treated with such urgency. You see these big bags of blood waiting by carriers, literally waiting to ship them out. And, you expect something similar at the tail end when you're getting infused, but it was just 3 syringes in a frozen vial. So it was disappointing. I was expecting some sci-fi movie, and it just turned out to be a colored room in a hospital with 3 vials. But it was obviously life-changing at the same time. I got infused, and me too. 2 weeks later, my lingering pain that I had for decades, even the pain that, my pain medication would literally not even touch. I just lived. This was just pain I had to live with and I was comfortable living with, had gone. And, I realized that this therapy is actually working rather quick. And I was shocked, happy, confused as well, because that's all I had known for 35 years was pain. And for the first time in my life, there was no pain. So that took some adjusting. But yeah, I received my infusion. I got dosed, and I came to realize that I am an extremely lucky individual to have gotten this treatment for free in a clinical trial. And yeah, that's what I'm trying to do now is make sure that one day everyone has access to the same therapy that I did.
Thank you so much, Shamik, and thanks to all of you for sharing. Now we have about 12 minutes left for questions. I would encourage the audience, if you have questions for them, to please put them into the chat. We'll do our best to get to them. To start with, I'll just ask a quick question. It was interesting that 2 of you at least said, oh, it wasn't quite as like scientific or sci-fi as I thought it might be. Are there other things that you wish you had known going into it that were maybe unforeseen? Anyone want to go first? Lee?
Sure. Yeah, I mean, I joke about this is this many multi-million-dollar product that I was expecting some sort of beefy security guards to be bringing in, and then it was just, a regular old IV with a nurse. But we were actually, the trial that we're in, the PI and everybody was very helpful as far as telling us what to expect, as far as what it would look like, and then what the post-dosing would look like. We knew Noah would get sick from the vector, and she did, flu, just moderate kind of flu-like symptoms for a little while. So we sort of knew what to expect in that way. Obviously, there were no answers as far as what to expect from results, but that is the exciting part. But as far as kind of the process itself, we had a pretty decent. I mean, the part that we didn't know and they couldn't answer was how long she would be on a steroid dose, and that ended up being about 6 months. That she was on that.
Thanks, Francita.
For the most part, I did a lot of research. Like Jimmy said, I heard Victoria's story, and they kind of couldn't really tell me too much because Caden was the first FDA approved pediatric patient here who got it. I think the only thing that I kind of wished I knew was like the chemo for him kind of gave him skin shedding. It had him turn really dark, and his skin started shedding all over. And they told me that it doesn't happen with everyone, and it's not usually occurs, but for him it did. And so when it started happening, I was like, what's going on? What's happening to your skin? So we weren't prepared for that. We were prepared for the hair to fall out, was prepared for fatigue, but we just wasn't prepared for that. And I think another thing that I think people may not talk about is just the mental state, because he's 18 at this point. You have to kind of prepare the child like mentally, because he's been through so much, like how to kind of deal with life and navigate life mentally with this whole new procedure throughout it and after.
Thanks. Jimmy?
I think for me, in hindsight, I wish I wasn't as desperate, which is hard to say, obviously, when you're in pain and living with sickle cell disease. As a human, as an animal, you want to stop pain. But when I look back, I wish, maybe, I know it's a fine line to walk between desperation and delayed gratification, if that makes sense. Not that I'm not happy with the outcome that I am experiencing with the gene therapy that I chose to go with, but I just wish I had explored other options. Even though there weren't many on the market, there was certainly another one in the option that Francita had, but I didn't even, I was just laser focused on getting the one I had read about. And like I said, I'm extremely happy with the outcome, but I think it would have behooved me, if I had looked and done more research to see the different types of therapy currently on the market and what's coming down in the pipeline, if I had the potential to wait, given that I'd lived with the disease for 35 years. Maybe you could live with it for one more year or a few more months to potentially try something else.
Thanks. As an extension of that, are there any questions that you wish you would have asked ahead of time? Lee, would you like to go first?
We asked a lot of questions. And when you're in a trial, like Noah is in, oftentimes there's more questions than answers, which is just the reality of being, being the one that they're trying it out on. No, I can't think of anything that we would have asked. Again, we have a very, very open and communicative care team, and so Lori and I are both the types that we like to ask. We're not shy about asking questions of Noah's care team, and so everybody was always very, very open. And honestly, one of the things that we really appreciated, which I didn't mention in the story, was that when we were, before Noah was dosed and in the months leading up to that, no one gave us any sort of false promises or false hope. It was helpful for us. We were in our most vulnerable state at that point, and the fact that no one, either with the team that runs the trial or the care team or the PI, that none of them would say to us, it will do this or anything even close to that. That was actually, in hindsight, really helpful for us.
Thanks. Francita, are there any questions you wish you would have asked ahead of time?
Just like Lee, we asked a lot of questions, We had family meetings with the doctors. I said, listen, I want you to tell me straight from the beginning to the end what can go wrong. And they were not shy to tell me this can go wrong, this can go wrong, this can go wrong. I'm like, okay, that's enough. So don't scare us too much. But we actually kind of asked all the questions. And plus, Kaden was admitted for that 2 months. So we were able to have access to them like that entire time. So if there were any other questions that we had or Kaden had, we kind of asked those questions that they could have answers because everybody outcome is a little bit different and may look a little different. So they told us everything that could possibly happen except that whole skin changing thing I was talking about.
Thank you. Jimmy, any questions you wish you would have asked?
I think all my questions were answered scientifically. Technically, the PI and his team really nailed everything down, and I knew exactly what to expect. What I wish I would have asked had more to deal with what life would look like post transplant. I was completely caught off guard, if I'm honest, with everything that I went through after receiving my therapy. I didn't expect it. I thought it would be, as that moniker we tend to use in the industry, the one-time treatment. And, I'll be sitting on the beach drinking margaritas. Was what I expected life to look like. And that turned out not to be the case because I was not expecting what I went through mentally. And I wish I had the foresight to ask about that. Hey, what does life look like after I'm dosed?
Thank you. I hope you made it to the beach at some point after that. So there was an interesting question that came in from the audience, which was, you are all now experts in your diseases, but also in having been treated with this disease. Um, what has been the impact on your lives of supporting the community around you and being the subject matter expert of that? Uh, Not only, again, the disease, but treatment and life post treatment. Jimmy, would you like to go first?
Absolutely. So life post treatment for me, if I'm honest, I've been failing a lot. Which off the bat sounds horrible. It's actually a good thing because that means I'm trying a lot of new things. So I'm doing things that I had never attempted before, because I'm now capable of doing those things physically and mentally. So by sheer mathematics, if I keep on doing as many things as possible, I'm eventually going to end up taking less L's. So I'm extremely happy that I'm failing. That's a fantastic thing. And but it's also opened doors for me in terms of to the other part of this question is, what we're doing to support the community. I've come to realize that all the things that I thought I once cared about, actually, I don't care about any of that. What I really care about is making sure that everyone can one day experience the same outcome. So that's actually, I've been able to find meaning in life. And for so long, that was always like, why the hell was I born with sickle cell disease? Now I know why. Is to eventually get this cure and then make sure everyone else with sickle cell disease can get this cure. So it's been a fantastic experience.
Thanks, Jimmy. Francita, what's been your experience in being an expert now?
An expert at 10 months after. I don't know about expert, but um, I think for us, life has been totally different after gene therapy. It took some time, like Jimmy says, mentally, it took some time for Kaden to kind of transition because he lived with this for so long. He kind of was still mimicking having sickle cell disease after as well because he still was confined in his room. He still was, because we had to be kind of like quarantined because of the chemo and because his immune system was down. So to him, life kind of looked the same after because he couldn't go out. He still was watching other people live their life. He still, wasn't able to do the things yet that he wanted to because he was still healing. But I think things started changing once he was able to do things that wasn't able to do when he had sickle cell pain. Like, he was able to go to school in person. He's able to go out. He's able to work out. It looks totally different now. And I think that's when his mental also changed. That's when it kind of switched. Okay, I'm healed. Okay, I can do this. But it wasn't like quickly like a change with his mental. And we share excuse me, our voices. Well, for me, like Jimmy, to get other people the same opportunities so they know our story, so they are able to get the same treatment. Because living with the disease, it's not just affects that one person who have it, it affects the entire family. So if we can get awareness out there just to people, how people live with sickle cell disease before gene therapy and how people live after gene therapy, that's our goal. That's our goal, is to just share our experience and our journey, to know, yeah, it's scary, but living with sickle cell disease is scarier to me, because the unknown, like Jimmy says, your organs, it's an organ thing. Anything, wherever there's blood in your body, sickle cell can affect. So if we use our voice and to get people kind of approved, because people do talk about the price of it. So we want, even insurance people just to kind of hear, this is saving people's lives. So to get opportunity for other people with sickle cell disease.
Thank you. Lee, same question.
Yeah, I mean, there's lots of different ways to define community, right? So for us, in the Canavan community, the Canavan disease community, for us, it's such a small group of people. It's a disease that impacts a few hundred people worldwide, maybe 1,000. We don't really know, but a tiny patient population. So for us, what's been a real, blessing about this journey is families find us. Families who are newly diagnosed find us because we're fairly public with our story, and so we get to help tell people. I mean, we never offer like this is what's going to happen, because Noah's experience is Noah's experience, but we do get to share our experience and talk about how the process went. We talk about a lot about the process because it's in depth. There's months and months and months post dosing of being under the microscope, MRIs, blood tests, all the stuff that we've heard about today. So for that community, just for the Canavan community, just being able to sort of share our story has been really impactful, I think, for me at least, and I think for our family. For the larger rare disease community, sharing Noah's story has been really wonderful, because it's a story of hope and shows the possibility of what these life-altering gene therapies can do, and so if we can help shape policy in any way that could help other kids, other future Noahs get access to these sort of life-altering, life-saving interventions, then it's wonderful. And so we do a lot of that, and it's been really, really rewarding.
Thank you. I can't believe it. We are actually over time. I just want to thank each of you for sharing such personal stories and giving a lot of hope, right, to the community around you. It's just so important. So thank you.